Hi, friends. So we are back with another video, and in this video, we'll be talking about radiology. Now, in today's world, we are we work in very close relationship with a new field, relatively, which is radiology. And day in day out, it helps us in making a good decision, which is in benefit of the patient. So I think it is very important that every surgeon may not know the full details of radiology, but they have to be comfortable with radiology and some basics about radiology. And that is why this session, we'll try to learn in this session that uh, we understand the basic principles of common imaging modalities which we use, including X-rays, ultrasounds, CT scans, MRIs, and some others. And also what and how we decide which is the most appropriate imaging investigation. Also, when we work with radiology and day in, day out, we have the radiology instruments are now coming inside our OTs and our workstations. So we have to also talk about risks and how safely we can use radiology. We use a lot of contrast. What is the safety profile of those contrast? And then also some bit about how to report and how to go about it. And this video is in series of several videos where one by one we will go detail of various imaging modalities. So let's see. Now the first question comes: why we need radiology at all? Uh, there was an era where everything was that open and see. If you are in a doubt, we open and we do a surgery and find out that what is going wrong with the patient. But now I think we are much better. We are a clinician, we are a decision maker, and then also imaging. We uh, we use imaging as a tool. This imaging helps us to understand the disease, understand the anatomy, understand the pathology, and also sometimes plan the surgery much before we go into the actual surgery. And with advancements, I think it is getting more and more easier, the planning part. So it is always said the more time you spend on planning, the better it is the actual work. So, and that is why we need radiology, mainly to understand the disease, anatomy, and also to plan the surgery. So it impacts our diagnosis, staging of the disease, operative planning. Also, sometimes we use intraoperative guidance like C-arms, and then also in follow-ups, what is the result, whether it's growing again or not. We all use radiology for that. So a best surgeon is not one who operates the most, but our teacher used to say that surgeons are of three generations or the three types of surgeon. In the early phase, we know what surgery is to be done, how is to be done. This is the early surgeon which is there, and these surgeons are very enthusiastic into doing and doing surgeries, and number of surgeries matter a lot. Then comes a phase when we start knowing the indication that, okay, this procedure is used here, this procedure is used here. And then comes the wise surgeons who know when not to operate. So a good surgeon or a best surgeon is one who knows what to see in imaging, by which you can avoid maybe an unnecessary operation, or when to do and when not to do. You start differentiating that. So radiology, I think, helps in that. What are the various modalities and the basic science behind it? We'll just talk about it briefly. Now, the first and foremost is the X-ray. Okay, X-ray we all know is a kind of ionizing radiation. So now, if you see here, there's a body which is placed in. So this is a generator which is which emits X-rays, which are ionizing radiation. Now, it is made to pass through a patient body. It, depending on what part, it can be lungs, it can be anywhere, but it passes through the intended object of interest or part of interest. And then it is the some radiation of it are absorbed or reflected back, and then some are allowed to pass through the body. Okay. Now, the radiations which are allowed to pass through that body part are then captured by electromagnetic or radiological films, which gets discolored by this or gets activated by these X-rays falling on that. Now, So we get a picture. It's like a camera where so the camera works like light falls on an object, it reflects back, and then the reflected light is on a photographic film. The same way here, it's an X-ray film. It's not reflecting back, we are capturing, but here capturing the past radiation. So the part, let's say, which allows more radiation to pass through it, which is like a more, you can imagine, like air and very light things, they will allow the X-rays to pass through them. So those will appear as black, and the parts which will not allow X-rays to pass through them, and generally they reflect back, they're called as radiopaque, they will appear as white. Now, so whenever we see an X-ray, we have to see the shades of gray, and brain should be trained in a way that whatever is black means it is soft, it is something which is transparent to X-rays. Okay. And something which is white, it means it is very dense. It does not allow the X-rays to pass through them. So with this, we train our mind. And you will see that in X-ray also, you will start seeing a various shades and various consistency of it. Okay. As we examine a body and we see, okay, this is hard, this is soft, this is firm. The same way X-ray also shows you hard, soft, and firm structures. Another thing which we should notice here is the way X-rays are passed. Okay. Now, X-rays is passed, they first converge, okay, and then they diverge before falling on the film. Okay. This thing is important to understand because let's say this is the object. If I decrease this distance, so you can understand very easily that the X-rays will distract much less before falling on the film. Okay. So in a way, the size will be smaller and it will be more sharp and crisp because they will not distract so much. Okay. So that another is become very important in understanding that which disease is where. That's why if we do the structures which are uh, posterior most, like towards the X-ray film, the structures, then they appear sharper in an X-ray film. So, for example, there are two objects, X1 and X2. X2 will appear little smaller but sharper whenever we take an X-ray. So this thing is important. Like, for example, if I do PA image, PA means the X-rays are entering the body from the posterior side and the X-ray film is on the anterior side. Like X-rays typically are done PA. Okay. So that means the part which is anterior means anterior is here and posterior is here. The anterior parts will be more sharper, and that because in X-rays typically you want to see the heart, the anterior more structures, and the lungs, not the vertebra, not the paraspinal muscles. So that's why we always do a PA image. Okay. Whereas let's say the image which is shown here is anterior is on the side of the X-ray generator, and posteriorly is the film's radio film. That's why this is an AP film. Okay. And you can see that more or less, depending on this distance, posterior structures will become more sharper. This you can see in various films. So there's a principal strength. X-rays is fast, very simple device to install. You just need a room and a machine, and you can do. Nowadays, we also have a handheld X-rays. It's just like a camera which you shoot, and the image comes on the digital platform. It is very widely available. Best use can be used for non-contrast emergency films like abdomen, chest X-rays, fractures, and all those things. Limitation is it does not distract too much. You can also see that either it is white or black, and you require a lot of expertise to understand those soft things. So the resolution between various grades of gray is very difficult in X-ray. And so grossly, it is very good for bones. It is very good for air. It is very good. But when you want to differentiate a tumor from a soft tissue, I don't think X-rays is a good investigation.